What I've done is I've taken a non-invasive low-level laser device called the Lapex BCS Lipo Laser. Basically, it's FDA cleared. You can lose inches. It's you place it on somebody's chin, on somebody's arms, on their stomach, on their legs, and in 9 sessions in 3 weeks, you can shrink and reduce those areas very effectively. And that's absolutely what it does. I've had this machine now for close to 10 years. It works phenomenal at that. But what happened is, as I started going through this, having more and more people come in, a lot of people started to show up. They don't have any really weight issue. They have some areas they want to tighten. They want to improve the look of areas. And they're easy, you know, they don't require much help. But when somebody comes in with a complicated case of weight gain, along with excess body fat, you know, rolls of body fat in their stomach, chin, and they're also overweight or their BMI is over 30%, these clients can be a challenge because they need more than just the 3 times a week that the laser provides. So what I found is I started to increase our services. So what we find is I've taken this non-invasive low-level laser and using it for spot fat reduction, and then I've combined it with weight loss, with nutrition guidelines, with whole body vibration, detoxification, and I saw that the laser worked really good at getting some quick results really fast on people's midsections or arms or legs. And as they went through the process, they started saying to me, hey, can you teach me more about diet and health? In other words, I'm seeing some results, I see hope, and now I'm motivated to start eating better. And so what happened is we instilled into all of our laser lipo plans a complete nutritional, classic traditional weight loss program along with the use of the laser. And it's included in the plan. We don't charge extra for the nutritional help. And we have it listed out here on a sheet of paper, exactly what's entailed in our laser lipo plans. And we get paid to do the laser, so we offer the nutritional stuff at no charge because you get better results. People feel better, they look better. Even people that really are very healthy and don't look like they want help, they appreciate the nutritional guidance. And since it's part of our standard procedure, it's not that difficult, and we've been able to help a lot more people with a lot more complicated problems than just needing some spot fat body reduction. These are the 2 types of people that I see in the office. Over here we have she's 120 pounds. She doesn't have very much visceral fat, and this is a very easy client to take care of. She might look at this and say, I'm very unhappy with the fat around my legs. I want to lose that. My mom had it. I've inherited it from my family. I'm embarrassed. It's cheesy looking. It disgusts me. I don't ever wear shorts, and my husband has never seen me with my clothes off because I'm so embarrassed with these outer thighs. And you can see them on this picture. Okay? 3 times a week for 3 weeks. You can bring that layer down of fat on the thigh to be as thin as you see on the legs. It releases the calories, the body burns it as energy, you get inch loss, and the people are very happy with that. And then what started happening was I started having people come in here that were more shaped like this person, who's 250 pounds, with a BMI of well over 35%, and they would come to me and say, I'm very unhappy with these rolls around my stomach. I'm very unhappy with my legs. I don't like between my thighs. I want to get rid of this fat. I want to do my chin and my underarms, and I want to lose weight. This is a very different case than the person over here, the skinny mini, we like to say. This person here needs more help. So the laser can help this heavy person by shrinking away the subcutaneous fat layer. These lasers, all the procedures, only target this outer layer of fat. It's called subcutaneous fat, and you see it on this diagram here. Okay, this is visceral fat, surrounds the organs affected by diet and exercise. The fat over here is called subcutaneous, and this is in front of the underneath the skin, in front of the muscle, and this is stubborn fat. This is hard to change, hard to get rid of that. This is what the laser targets. This is what liposuction targets. This is what all the procedures are targeting, this outer layer. And in my opinion, the low-level laser, the Lapex, is the best treatment to get rid of this outer layer because it doesn't damage the tissue. It simply uses a very low-level energy, red light, which is all around us. And after 8 to 10 minutes of applying that energy to those fat cells open up, they release their fatty acid, the contents, and then you absorb those fatty acids through the natural process, through the lymphatic system, by using whole body vibration. You don't eat 2 hours before you come into the laser, 2 hours afterwards. And in that 2-hour window, you're going to burn those released calories from the laser. At the end of that laser application, immediately you have an inch loss. So most people will lose a ½ inch to an inch in the 3 spots. So the first visit, 1 to 2 inches, 9 sessions, 6 to 9 inches accumulative. It really works that way. You do not have to wait 3 months for results like with Cool Sculpting. There's no possible risk of any cellular damage or any tissue damage. It doesn't destroy tissue. Cool Sculpting, Safe Sculpt, RF, Vanquish, Cavi Lipo, liposuction. These are all using energy to destroy fatty tissue, to have it removed from the body, in a belief that you're going to be better off not having those calories. And what they're starting to show is the literature is showing that your fatty tissue, those fat cells are called adipose tissue, are more than just mindless containers for fat. They are very important to your overall metabolism. In fact, your fatty tissue is an endocrine system. Just like your thyroid, just like your adrenal glands, just like your pituitary, just like your female and male sex hormones, your fatty tissue is an endocrine system. And when you remove tissue, when you take fat cells away from the body through sucking them out or burning them or freezing them, what happens is the body over time will want to repopulate those areas. It wants to put those fat cells back. And since they're removed from that area, they'll put them somewhere else. They call it fat migration. Our procedure, no possible chance of fat migration. You should know that. That's very important to know that. With liposuction, especially with liposuction, 4, 5, 6 years later, most people will suffer from fat migration. Now this is what it looks like, fat migration. I will show you a picture of this. This is from the New York Times. This shows a person who's very unhappy with their hips. And then she has the liposuction and she's happy with her hips and her waist. 1 to 2 to 3 years later, through fat migration, it goes to the upper back, up to the upper body. And this is a side effect of removing tissue. This can happen in liposuction or any procedure that destroys fat, such as Cool Sculpting or Sculpture. So you're not really better off removing tissue. You just want it to be smaller, which is what our laser does. Again, instead of destroying the tissue, 30 minutes of laser application causes the fatty acid to be released into the tissues. Then you stand on a whole body vibration plate for 10 minutes, shake those calories into the system, you burn them over the next 2 hours, you've effectively burned the calories, reduced the subcutaneous compartment, and you see an inch loss every time you see it. That's pretty powerful. That's what we do. 3 times a week for 3 weeks is our normal process. Now, yes, people do more visits, but all the pictures you see at the spa, all the testimonials, we want you to be able to see a picture and look at somebody's testimonial and identify with their story and realize they did this in 3 weeks, not after, any process which uses thermal energy and either hot or cold or fat sucking is going to have a 3-month to 8-month to 12-month healing process after the procedure. They don't go to a Cool Sculpting client and the day they walk out take a picture of their area because it's been frozen, it has a redness to it, there can be a hematoma. It's not done. It takes 3 months for the body to absorb that process. And in the meantime, in 3 months, that's a long time to be tanning and exercising and preparing for this picture. At the Slim Body Laser Spa or at the Low Level Laser, we take pictures at the 3rd week at the last visit. So chances are those inch results came as a result of the laser, not from not from exercise and diet.